Hi, I'm Dr. Russ Greenfield. I'm a conventionally trained physician. I attended medical school in Chicago and trained in emergency medicine on the West Coast. Even did additional fellowship training in emergency medicine. I've practiced emergency medicine in academic realms and community realms. But really my great good fortune was that in 1997, I was accepted into the program in integrative medicine as one of the first 4 physicians worldwide to enter into such a program. The idea being is that we want to change the healthcare system for the better.
If that private I can't see, Mama, don't you give that ring to me.
Well, I have very strong feelings about immunization, and I get asked about them whenever I speak in public. I think the benefits of immunization greatly outweigh the risks. And I think if people lived with the diseases that these immunizations prevent, that is, if we lived with tetanus and polio and diphtheria, nobody would question the wisdom of immunization. I think there are legitimate questions about how we immunize, whether we start too early, whether we're giving too many immunizations at once, whether we should ever have embarked on a program of universal chickenpox immunization, for example, which I think is not a great idea. Those are all legitimate questions, but I think the idea of immunization is very, very sound, and the benefits are terrific. It's not without risk, as no medical procedure is without risk, but the benefits greatly outweigh the risks.
I agree absolutely. We don't know which children, if any, might be susceptible to side effects from specific vaccines. But we know that all kids are susceptible to the illnesses that the vaccines prevent. And that's why right now, far and away, the benefits far outweigh the perceived risks.
Right. Immunizations do not cause autism. I think that's been set to rest. I think there are strategies to minimize risk from vaccines. For example, only immunizing when an infant or a child is in good health. There are some homeopathic remedies that can be used that reduce vaccine reactions. And also vaccines are getting better and better. As with the pertussis whooping cough vaccine, the old one that was most associated with severe reactions has been replaced by a better one.
Right. And along the same lines, there have been concerns for years about the additive thimerosal and is mercury causing autism, causing all these problems. And, thankfully, the industry and the government have responded by taking it out of almost all the vaccines out there. But even before, even after thimerosal was removed, rates of autism have continued to climb. And so you're absolutely right. None of the data, and there have been some very good studies and very in-depth, at least 12 randomized trials and reviews that show that autism is not tied to the MMR vaccine. So I think there's a lot of fear and a lot of fear-mongering out there, actually, but the vaccines prevent very, very bad illnesses, and it's very important to vaccinate our children.
Hey!